Now, today we'll be discussing about myocardial bridging or myocardial bridge. Now, what is this myocardial bridge? This is basically a coronary angiography finding. Now, what actually happens very commonly when patients present with chest pain or shortness of breath or lethargy or sweating or chest uneasiness, wherever we do an ECG, or because of some reason, if ECG shows ST changes or T wave changes like ST depression or T wave inversion, then very commonly these patients, in view of either presence of diabetes or hypertension or smoking or alcohol, or in view of elderly age, along with the ECG change and with the symptoms, are very commonly advised coronary angiography. One more thing, very commonly, routinely, uh, TMT is also done in so many corporate sectors. They are given option of either 2D echo or TMT or both every year. And very commonly, the patient may have positive TMT. What do you mean by positive TMT? Is the ECG usually shows normal ECG changes. Normal ECG changes means usually there are no ST depression, no T wave inversion, or no ST elevations. But whenever they do TMT, after doing TMT or during TMT, what they show is they show new onset of STT changes like ST depression or T wave inversion. So this abnormal ECG, especially in presence of the symptoms and in presence of with the comorbidities like hypertension, diabetes, COPD, or smoking or alcoholism, these patients are very commonly advised the coronary angiography. So in that, we see this finding which is called myocardial bridge. Now, what exactly is myocardial bridge? To understand, we need to see that the heart, which is a three-dimensional structure, and over that, what we have are we have left anterior descending, right coronary artery, left circumflex artery, and like posterior descending artery and other arteries or their branches like OM and other branches. So these arteries are actually epicardial. What do you mean by epicardial is, suppose if you have, this is the muscle mass, this is the left ventricular muscle mass. So we know that this is all left ventricular muscle, which is usually around 1 centimeter in thickness. So epicardial means the artery will be above that muscle. So if this is the left anterior descending artery, this will be above this muscle. So even if the muscle gets into hypertrophy, even if the heart rate is whatever it is, whether it is the heart rate is more or less or it is normal, or even if there is left ventricular hypertrophy, even if there is increase in the left ventricular thickness, this left anterior descending artery remains separate from this muscle. But what happens in the myocardial bridge is we what we see is if this is the suppose left ventricular muscle mass, and what happens in myocardial bridge is this is the portion of left anterior descending which is epicardial, means epi means above the muscle, so it is epicardial, and some portion of the left anterior descending artery or any artery, it can be left circumflex, right coronary artery, it usually gets embedded into the muscle. So we know that this portion is actually a bridge between this portion of epicardial artery and this portion of epicardial artery. This is actually intramuscular portion of this left ventricular artery. So when heart rate is suppose normal, it is around 60, 70, 80, 90. Whenever this muscle contracts, it automatically puts pressure onto this left anterior descending artery. So the blood flow during that contraction gets reduced to the muscle which is supplied by this artery. So when heart rate is 120, 130, That can happen during fever, that can happen during running, jogging, when the patient is doing TMT, or when the patient is under stress. So during this phase, automatically, because of the intramuscular course of this artery, the ECG changes may appear, TMT changes may appear, patient may develop pain, patient may develop sweating, patient may develop uneasiness, which is purely because of the poor blood flow during that particular period, because the muscle is actually directly compressing this artery and reducing the lumen, and that during that period of the time the blood flow is lesser. So this is the reason why it is called myocardial bridge, because it is a bridge which is there in the myocardium. So for this, you actually don't need any angioplasty. You don't need to repair. You don't need to put a stent there. In that, we usually give a beta blocker so that the heart rate can remain less, because less means the tachycardia, because in the tachycardia the muscle demand of oxygen increase and the flow gets reduced because the artery is getting compressed. So there is a discrepancy between demand and supply. That is the reason why the pain, sweating, and other changes may worsen. So giving beta blocker reduces the heart rate. It keeps heart rate maybe in between 60, 70, 80, so that the flow can be maintained well, the artery will be compressed less, and the symptoms will not appear. And very commonly, if the patient has the risk factors like diabetes, hypertension, smoking, alcoholism, cancers, then very commonly patient is usually put on single antiplatelet drug like aspirin or ecosprin, and most of the time 75 milligram is more than sufficient. Very of the time patient is also put on the statins like atorvastatin, which can be 10 to 14 milligram can be given, or rosuvastatin 10 to 20 milligram can be given. So this is what is myocardial bridge, and thanks for listening and have a good day.